Welcome everybody. Thank you for joining before folks break for holidays. I'm going to ask that folks introduce themselves in the chat, share your name, your organization and role, and your favorite holiday dessert, whatever that might be. And as you'll see, just as I'm letting folks in and folks are thinking of their favorite dessert, I would suggest for today, although there will be a lot of slides, so I don't actually know that it matters. I was going to suggest that people use speaker view today, so I'll just remind you how to do that. But again, it actually might not matter because we have a decent amount of slides being shared today. I don't think Sandy's on at this time. I know she was potentially joining late, but I do just want everyone to know that Macy Reed, who was previously on our executive committee representing Boston Medical Center, transitioned into a different role and had suggested and recommended Sandy Molitieri to join us. She's the Director of Talent Acquisition at BMC, and she's not on right now. She will be joining us in a bit, but I wanted to make sure that she's introduced so you're all aware. And that you know who's on our executive committee.
I'm actually on. I'm just on the phone. Sorry. I'm
Sandy.
Walking from my parking garage. Sorry. You can't see me because I'm on the phone only. Sorry.
Your name. Feel free to give yourself an introduction.
Oh, no problem. So hi, everybody. Sorry you can't see me yet. I'm still commuting to the office. So my name's Sandy Molitieri. I'm the Director of Talent Acquisition at Boston Medical Center. I've been here almost 3 months. And I think I did miss one of the meetings, so I apologize for that, but I was glad to transition and kind of take over the reins from Macy when I joined. So I'm looking forward to getting to know everybody and to participate in all these meetings that we have. So thank you.
Terrific. Thank you, Sandy. And so today we have a packed agenda. It went from like, oh, we'll have some wiggle room to back to packed. So we're going to start with 2 announcements. We'll have Dawn from RCC share about their externships and more information with you all. And then we have Natasha, the consultant that's working with the Office of Workforce Development, who will share some information about the application going in for the EDA's Good Jobs Challenge. We'll then transition to our first of our 2 main presentations this morning. The first being a deeper dive into the Workforce Success Grant for Training and Placement Programs. We'll give an overview, a brief overview of the mass hire system, just so folks are aware because of the connections to most grant applications. And then Teresa Rowland will present more on the actual grant itself. Then we're going to transition to special guests, Amy and others from Care for America's Aging, and we'll give more details on that in a bit before we wrap up. So as I multitask here and let people in, I'm going to transition over. I'm actually going to stop sharing this one and share another screen and pass it over to Dawn Craig, the Allied Health Program Manager in the Center of Workforce Development at Roxbury Community College. And I will share my screen for you, Dawn.
Thank you, Ashley. Good morning, everyone. Thank you for letting me join. I look forward to working with all of you. That would be wonderful. Okay, so I am the Allied Health Program Manager for Roxbury Community College. I'm sure most of you are familiar with our community college and what we're able to offer. So some of our healthcare training programs that we offer here: medical billing and coding, phlebotomy, pharmacy technician, and clinical medical assisting. Okay, our phlebotomy program, just to give you a brief overview of what students will experience while they're here. It's a 220-hour program with classroom instruction. Some of the things that they learn: terminology, anatomy and physiology, OSHA, BBPs, universal precautions, test requirements, tube identification. They have to know, obviously, their order of draw before they leave the classroom. So the certificate program includes 3 components: 90 hours of phlebotomy instruction and skill labs, and then 10 hours of work readiness and 120 hours of externship. And that's where some of you might come in. Okay, so the work readiness and externship. 10 hours of work readiness training during their 2nd semester. And it goes over things such as formatting a cover letter, having a eye-catching resume, and interview skills as well. Externship is a total of 120 hours. And in that time, the students do have to obtain 100 successful venipunctures. Okay, clinical medical assisting. Okay, so 55 hours of clinical medical assisting, 55 hours of CMA phlebotomy, 30 hours of EKG, again, 10 hours of work readiness training, and 160 hours of externship for a medical assisting program. Okay, also 2 weeks of the work readiness, I apologize. And their externship is a total of 160 hours and involves a minimum of 2 weeks full-time. And again, externships for the programs at this time are not paid. Okay, any questions?
Dawn, when are you seeking externships for? And
So
how many are you, do you have an estimate of how many slots you're looking for?
Good, thank you, MG. We have a group who's just finishing up or just getting ready to begin their externship. I'm not sure if everyone has been placed, but there are about 20 students that will be looking for placement come April or May. And then we will have some students that will be finishing up their spring semester in June or July, maybe August. And in that cohort, we're probably going to have 60-ish students.
And that's between all of the specialties? Between
all of the programs, yes.
Great. Okay.
If you like, I could send you a breakdown per program if that would make things easier for you.
Yeah,
MJ.
I think that would be great because we could share that with the group and see if anyone could grab them.
Excellent, great. So we also have a pharmacy technician program. Okay, you can advance again, please, Ashley.
Is it, all right, do you want it on the about the program slide? Is that showing up?
No, you can advance through that one.
Okay, sorry.
That's okay, my fault. Okay, so 130-hour hybrid program introduces students to phlebotomy, theoretical knowledge, etc. The program includes taking the PTCB national and state pharmacy exams as requisites for course completion. Thanks. Again, 10 hours of work readiness training. Then we find that's very important for students. It helps them fine tune some of their soft skills. Okay, here is my contact information, my email address. Again, my name is Dawn Craig, and I'm sure most of you know our director, Salvador Pina. You can also please feel free to reach out to him if you have any questions or would like further information.
Thank you so much, Dawn. I'm going to stop sharing in a minute just in case folks need Dawn's contact info, and maybe Dawn, if you can also throw it in the chat.
Sure.
We have one question in the chat from Michelle Silveria, and then I see Daniel has his hand raised. So Michelle Silveria had asked, is it possible to roll the medical assistant training program into an associate's degree?
We don't offer an associate's degree for in our area. I can certainly, Salvador, can you address that?
Yeah, excuse me. Right now, we have our nursing program that we offer as an associate degree, and we have not worked on trying to connect those two pieces, although we do find that students who are in our nursing degree sometimes take our clinical medical assistant training. We're looking long-term at how we can do that with all of our medical programs. We most recently hired an associate vice president of workforce development who was on the credit side, and with the goal of trying to see how we could bring some of these programs together.
Thank you. And Daniel?
Yeah, I have a couple questions. I'm interested to know when folks finish the program and start working in those different fields, what's the typical salaries like for their jobs? And then the other question that I wanted to know is, so one of them I saw was like about 6-7 months, I think. Is that the same length for all three of the programs?
Okay, good questions, Daniel. Thank you. So as far as salary, things just range so much, and everything is so off the charts now. It's really hard to give a solid answer to that. So I've seen ad postings where medical assistants, for instance, are starting at $13 an hour, and then the next ad will start them at 25. So it's really difficult to pinpoint what the salary range is going to be, especially with everything that's going on today. And your second question, our programs are basically geared towards students that need to quickly get trained and get in the job field. So there are other programs that might be 9 months or 12 months or 15 months. And they go into things in a lot more detail than we do. Our students need to get out and get working. So we give them the basic level of skills that they need so that they can get out in the workforce, and during their externship, they're going to pick up a lot more training. Okay? Also, one of the things that we don't spend a lot of time on is the administration, okay? Because most of our students are so computer savvy that when they get out into the workforce, they're easily going to be able to pick up whatever type of software program or EMR program is being used out in the field.
Awesome. And is the program free?
This semester, our spring semester, our programs are being covered by a train grant. Okay. Normally, there is a tuition.
Thank you.
And Daniel, I just would add that, you know, one of the things that we really try to do is get all of our programs certified to a third party as best we can. So we work a lot with NHA and with the PTCB in our pharmacy tech program. So that generally dictates the requirements for the program in terms of number of hours. But I think Donna is correct to say that our goal is really, you know, moving students through a program as quickly as possible to get them into the workplace.
Oh, that's great. Thank you.
Thank you so much. I am going to transition us. I want to draw Sal and Dawn. I will draw your attention. Colleen did post a question in the chat that maybe you can answer in the chat. But our next presenter, Natasha, has a hard stop that she has to go at 9. So I want to make sure to introduce Natasha and give her a moment to share a bit. So for context, the Office of Workforce Development, as I previously mentioned, is applying to the EDA's American Rescue Plan's Good Jobs Challenge. Previously, MJ Ryan and Joanne Pekaski of our executive committee spoke with OWD about the potential role that the Healthcare Careers Consortium could play in the grant. And so we've now moved along in that process, and I've asked Natasha Goldman of Wison Inc. Here to share some information about the grant proposal and potentially what she might need of us as the consortium and to introduce an employer survey. So take it away, Natasha.
Thank you so much, Ashley. So good morning, everyone. I'm honored to be here with you today. Like Ashley said, my company, Wison Incorporated, we're a consultancy. We work with nonprofits and higher education to win federal grants and make your dreams come true. So I'm super glad to be on this project. I'm going to share my screen. I've been working with OWD and lots of partners in order to create a project for this grant where the PIC is the backbone organization. That means they are the conductor who is conducting the symphony. And we have lots of partners, including outreach, workforce community, recruitment and assessment, and community colleges. Right now, BHCC for healthcare, BHCC, RCC, and Mass Bay are in that blue box up here. So this has to be a little bit updated. Apologies for that. really important here is that what we want to do and what the EDA, what the feds require us to do is to bring employers in early in the process. What does that mean? They are asking interested employers to commit to things like work to earn, apprenticeships, training, conditional hires, and actual job numbers if possible. If you choose to be a part of this project, it means that you would be interfacing with the trainers. Those are the community college, JVS, or other trainers that you like to work with, and talking to them about the kinds of possibilities that you have for workers. When we talk about job numbers and commitments, it's perfectly fine for you to guesstimate and say, we know that we usually hire 5 phlebotomists, so we can definitely commit to 5. We'd like to see more numbers, but we understand that employers might not be able to do that. So the communication and the interface with employers is going to come earlier in the process rather than later. That means a student at RCC who joins RCC, they're going to get placed with a career advisor right away. They're going to learn about job ladders. They're going to learn about the jobs that employers have available and whether they have apprenticeships, conditional hires, training, et cetera, available to them. Based on that information, they will choose their plan of study. They'll work with a career coach throughout. Employers will come in again, make sure that they have really completed all the training they need, and then they get placed with you, the employers. So what our hope is that community colleges have, or maybe some of them have already reached out to you if you have established relationships with them. Otherwise, you'll be hearing from Ashley to answer an employer survey with questions directed at you in order to get the information we need for the application. Unfortunately, I don't have that link at my fingertips to post that in the chat, but I can forward that to you as quickly as possible. So I'm happy to take your questions. I'll put my contact number in the chat, if I can find that right now.
And I'll just add to what Natasha said. We see this as an opportunity to bring more resources into healthcare training in the Boston area. And so, you know, we're still figuring out the perfect model. This is where we're at right now. Clearly, we'll have to be very detailed to operationalize it, but it's an opportunity. You know, we have a lot of employers who are very invested in training people up to healthcare jobs. And this is an opportunity to kind of bring more resources into the local area. So thank you, Natasha, for leading us on this.
All partners will get funding. So thank you, Joanne. If you need more trainers, if you need someone to help workers navigate to career ladders, as a partner, you can submit requests for funding at the application stage. It's a $20 million grant that we're going for. So I want to make that clear. Employers get funds to make this happen.
Thank you so much, Natasha. I welcome any questions, whether that's in the chat or if you want to raise your hand or unmute. I also just wanted to make sure that everyone knows I just put the survey into the chat, and we'll make sure to include that in our follow-up communications in the newsletter. Feel free to reach out to me directly if you have any additional questions, if you want to be connected to Natasha or what have you, but you can always reach out to me directly, and whether I have the answer or I'll find whoever has the answer and we'll make the connections necessary.
Ashley, I might just add, as someone observing from a distance, you know, what's cool about this, in addition to the 20 million and the ability to fund employers on to be part of the project in terms of the program costs. It's not just that employers are involved in the beginning. Hell, this thing is happening so fast, you know, our heads are spinning. But that employers are involved early in the process of implementing the program, maybe even as early as being involved in the selection of and recruitment of participants. I mean, you know, I think what we're learning, you know, in general, is that when employers are involved in identifying candidates for training the possibilities of their being hired from among that employer group just, rise exponentially. I think that was our experience with a really early healthcare careers consortium piece where employers got involved in coaching certificate participants, through their programs. So really cool stuff that we've been involved in, can be marbled into this. It's a very flexible opportunity to coordinate the spending of 20 million bucks.
Thank you, Neil. And I did get a direct message asking who's funding this grant. So again, to clarify, the Office of Workforce Development is applying for the grant, but the grant is through the U.S. Economic Development Administration, and it's part of the American Rescue Plan's Good Jobs Challenge. So it's a federal grant. Excellent. Okay. So I think if no one has further questions, or at least questions at this time for Natasha, thank you so much for your time and all the energy that you're putting into this work. And we appreciate you being able to jump on this morning.
My pleasure. So nice to meet you all. Thanks.
And if I could just add, it's very important for our employers who are interested in this to, when Ashley sends out the survey, to fill it out and get back to Ashley about your level of interest.
Thank you so much, Joanne. Thanks again, Natasha.
All right, thanks so much, Natasha, and especially for that last minute request. We appreciate you attending today, and that was really a good demonstration of all the things that are out there. And I know we're all getting inundated with good news. It's very rare that you're confused by the amount of money that's out there and just don't know what to do with it. That's just like, I don't know, head spinning. But with that, it might be a good idea for us to get some ideas of what is going on and on how we can maybe get to some collective impact. We're going to hear from Angela McCabe now, Director of Workforce Development at the Boston Private Industry Council, and she's going to give us a brief overview of the mass hire system. Teresa Rowland, Senior VP for Programming and Workforce
Skills Cabinet.
Yeah, thanks. Hello,
Gotcha.
Teresa at the ComCorp. Will walk us through some best practices with the workforce success grants and training and placement programs for some examples for us, because we need to wrap our heads around how to spend all this money. So thanks, Angela. Take it away.
Thank you, MJ. Okay, I just lost my screen. Okay, I got the slides now. You want to move the slides? We're going to do a very, very, very quick overview for those of you who have not really paid much attention to how the system is changing. I wanted to do a few quick explanations of where we are and who these super regions are and what you need to do. So as you all know, Massachusetts has 16 workforce boards. If you look at the map, you can see they're right across the state, and Boston is way in the corner, probably around the Boston geography, but it's real small. Yeah, I know. We also have 4 affiliated mass hire sites. 2 of those are in Boston. One is 2 of them are working with, actually we have 3 in Boston. 2 are working with JVS, that is the St. Francis House Access Point, and the other is the Working Access Point, serving Dorchester. And the 3rd one is in Charlestown, working with Mass Hire Boston. There are also 3 youth-specific career centers. One is in Lowell. I think one is in Lawrence also. So, that's a model that, we've also looked at in Boston and may continue to look at. Next slide, actually. So under the Workforce Skills Cabinet, they combined all of these regions to be these 7 key workforce regions, super regions. As you can see, our region is number 5, the green one, and we got remarkably bigger. We went from 1 city of Boston up to 64 cities and towns. This is wonderful for our employers because it's now we're all collaborating and we have coverage in all these regions. But as you can see from the chart, we also have most of the jobs and most of the workforce. So it is a big region to serve. It is a lot of people and it's a lot of employers. And currently we're working with the state on how they should fund these regions, because obviously the needs in Region 5 are different to the needs in Region 1. Ashley. So just to cover the greater Boston city for cities and towns, If you are working in any of these towns, if you are working with any of the employers in these towns, you should know who your workforce development director is, and you should know where your career centers are. We love our Mass Hire brand. We love it. We're unified under our Mass Hire brand, but it just got confusing because Mass Hire is now workforce boards. So in the Greater Boston region, it's Neil Sullivan at the Mass Hire Boston Workforce Board. It's Chris Albruzio Lee at the Metro North Workforce Board and Greg Bunn in Metro Southwest. That is where you will probably go for your letters of support. And we'll get to that in a second. There are also multiple career centers under those regions. So you have 2 Mass Hire career centers in Boston. That is Mass Hire Boston, Mass Hire Downtown Boston. The same in Metro North, Chelsea, Woburn, and Cambridge, and in Metro Southwest in Framingham and Norwood. So when you're asked, actually next slide, when you're asked to get buy-in from your Mass Hires, it'll probably say from your local workforce board and from your American Job Center. That's the federal name for the one-stop career centers. So it will say that, especially in every state grant, it will say, please work with your Mass Hire workforce board and career centers. You will need a letter of support or an MOU with one or both of those entities before any grant. The Mass Hire brand also will cover things like Division of Career Services and other entities under the umbrella of Mass Hire. Oh, Michelle, okay. Next slide. So as a workforce board, we do not do the direct service. Obviously, the career centers do direct service, and as you look at recruitment and assessment, that's where you will go. For the Mass Hire workforce boards, we will provide you with labor market information. One of the things you will see on every grant is that they want you to align with the regional plan. The regional plan is that super region number 5. We put out a regional plan every couple of years. We updated. In our region, the focus, the priority is healthcare and IT. There's a selection of occupations under those industries. If your training program doesn't fit in one of those industries, talk to me, talk to the board, talk to Neil. It may have a local focus. It may not meet the regional, which had to be a common industry across all 3 regions. But I know in Boston, construction is a priority region. It does not come to the top in regional planning, but in Boston it does. So talk to your board if you think you don't see your fit, but you might want to talk about how to get into a grant. The other thing that's on the websites is in each of the 3 boards will have their 4-year plan up. This is our plan to use WIOA public funding dollars over the next 4 years, primarily around training and career centers. As you're here today, you can tell our role is also convening stakeholders. It's good to not be the service provider and therefore be able to bring all the interested parties together and connect you with each other, so there isn't a lot of duplication of effort. I think I know I'm going very fast, but I know the employers appreciate that because they don't have to have 16, 17 different training providers approach them if they can talk to Ashley, and Ashley can give the overview and connect them all with the right people. The last thing we do is sometimes when we go for grants, there just isn't enough money. So we start to look at other funding that's out there. It could be the Workforce Training Fund. It could be WIOA funding. Sal, you just talked about your program. Because it has a certificate at the end and it's 6 to 9 months, it's probably eligible for WIOA funding. So when the train grant runs out and others want to take this program, they could probably get the WIOA dollars to do that. Anybody's not clear on how that works, contact me afterwards. I'll have my email in the chat box. So we can kind of work with you to think about what else is out there that can be blended to make your grant more attractive.
Thank you so much, Angela.
Oh, yes, that's all the slides. Thank you all.
Yeah,
I did it. My email will be in the chat box if anybody has questions.
And before we transition over to Teresa, I figured I'd just do a quick pause to see if anyone has specific questions on the what can seem confusing Mass Hire brand or regional planning and regions and all of what Angela just covered. Oh, here, let me check the chat.
Neil, do you have any questions for me?
No questions. We're just lucky to have Angela for the answer. a lot of people depend on Angela for the answers.
I was so tempted to put your name in the box.
Yeah, thank you very much.
Excellent.
I'm learning all the time, but Angela knows more about this stuff than anyone I know.
Excellent. Thank you both. At this time, I want to welcome Teresa Rowland, again, Senior Vice President of Programming in the Workforce Skills Cabinet Liaison at Comcor.
Thanks, Ashley. And thanks so much for everybody for inviting me. I really appreciate it. And lots of familiar faces. So good to see you all. And I have some colleagues on the phone also from Comcor who I know regularly attend this, Karen Scheck and Tommy Heverin. So if there'll be a more common presence at these meetings, so feel free to tap into them on an ongoing basis as well. I wanted to give a little bit of an update on an intro you received from the Boston Consulting Group at one of your previous meetings. We've continued to plug away at some work around how ARPA dollars will be supporting workforce. And then I wanted to do, Ashley asked me to do a little bit of a deep dive into one of the grant opportunities that's available now, that and do some little discussion around some best practices. Commonwealth Corporation sits as a staff member on the Workforce Skills Cabinet. The Workforce Skills Cabinet is a cabinet made up of the Secretaries of Labor and Workforce Development, Housing and Economic Development, and Education. And together they develop strategy around workforce. And in particular, spent a lot of time over the last year in the recovery and really preparing for the allocation of how we would utilize ARPA funds, federal ARPA funds, to best support upskilling and getting folks back to work and meeting employer vacancies. Over the summer, we were certainly waiting to find out the decision about how the funds would be allocated from the legislature and any considerations there. But we had begun this work with our regional partners, including the Mass Hire. And so certainly thanks to Neil and Angela and Ashley for all their work and getting this at the regional level up and running as well and started. So just wanted to give you a little bit of snapshot of what all the moving pieces are. I'll do this really high level and then dive into one of these grant programs in particular. So what you should know is there's 240 million plus, because we keep reading through the ARPA bill and you find something else that's a little bit different for upskilling pathways, to if you're combining some state and some ARPA dollars. And so we've really been looking at that portfolio. And as of November, what we are considering this down payment, we've already allocated $80 million to go out to bid through a variety of procurements and capacity building activities. And so there's a lot of grant programs for training, and we're calling this the Future Skills Grant Support. So we're kind of this bundle of all these different grant programs that are a variety of things that we're supporting, or where there's some earmarks in the ARPA bill. And then there's also we're trying to reach out to other state agencies outside of the cabinet to understand what are the other workforce programs that other secretariats and agencies might be developing, and how can we make sure that we're coordinating. I think this is very true. As MJ said, there's like so many resources, it's hard to keep up with all of what they are. So we're trying to make sure that we're doing a good job of trying to coordinate. But on the left-hand side, we also just realized, on day one, the capacity constraints. And really, if we wanted to utilize these resources effectively within the regions, we needed to lay some groundwork to support on capacity. And so there were grants that went to those 7 regional teams that Angela showed on her super region map. So and Angela and Ashley and Neil being a lead for the greater Boston region, to do some planning to figure out how would you allocate future resources. We have also begun to invest in these roles called market makers, whose job will be to go out and talk with employers, not to duplicate the work that you might know that career centers already do in terms of helping recruit for employers, but really helping an employer think through when is a pipeline strategy needed and how to support the development of that pipeline strategy to access some grant resources. So when there's just not enough warm bodies to fill their roles, how do you develop a pipeline strategy? And then also something that is very important, as you all know, the the challenge of recruiting workers right now is very similar to the challenge of recruiting individuals to participate in training programs. And so we're putting into place these upskilling navigators, one at every career center, whose job it will be to understand all the training programs that are being funded in the area, what the requirements are, and to try to get ready people into those programs and working in partnership with local training providers. And then there's a variety of other things that are listed here that I won't go into detail, but just to know, like, there's other things we're hearing, right? It's hard to recruit instructors right now. So how do we deal with that? Wanting to make sure that we're, again, making it easy for folks to access grants, that it's easy to understand information about what are the grants that are available. So there's a lot of what we're doing in terms of getting the grants out the door, but there's also a variety of capacity resources available. Next slide, please. And so there are 3 of the grant programs that were listed on the previous screen that ComCore is responsible for managing. I'm going to talk about one of these in detail, the very top one, but I just wanted to give you a sense of, we're also managing a couple other programs, and there are a variety of programs that are available for different industries and different models. This very bottom line is what we call CTI, is a career technical initiative that supports vocational schools to focus on training for construction and manufacturing. And then the 2 that are at the top are very similar. The Workforce Competitiveness Trust Fund, which I'm going to talk about today, you might all be familiar with. And Renew is a newer program that we're just launching this year. Both of them support training and placement programs, so that the actual tuition costs and all the wraparound support services to help train somebody with the required skills and credentials to meet in-demand occupational needs. The Renew feature allows for an individual, a single employer, to identify and articulate their needs for hiring and work with in a very singular pathway. And that's the value proposition, and the idea that the employer would actually pay back 50% upon hiring. So this is a newer model for us, but it looks very similar to the Workforce Competitiveness Trust Fund. And if you think you know of an employer who might be interested in designing a program that's really unique for just their one organization, we'd be happy to talk more with them and get them some resources about what that would look like. So we go to the next slide. And this is the detail about the one opportunity I wanted to talk about. So we have a fund in Massachusetts called the Workforce Competitiveness Trust Fund. I did not name it, nor name the grant program that sits under that, which is the Workforce Success Grants. But these are grants. The fund has been around since 2006 and helps support training and placement programs. They're employer-led partnerships. We need employers at the table and require at least 2 employers to articulate the needs and of the in terms of the specific occupations, but also like what are the credential needs, what are the work experience needs, how do we best prepare them for jobs. We typically focus on folks who are unemployed and underemployed and low income in order to help provide them the assistance that they need. This program is open across all industries, excluding manufacturing, because there's a separate dedicated manufacturing fund available. And this it provides a variety of different resources in addition to training and the placement services, but we offer technical assistance. And there's also, you can use resources for marketing and recruitment, a variety of different costs. So healthcare is certainly in the blueprint regions. And as Angela said, feel free to reach out to her if you have any questions about what's included in the blueprint or not. I did want to just say, we also have identified both CDL drivers and childcare workers as a statewide priority. So even though those don't show up in individual blueprints, those are still statewide priorities that we are focusing on in allowable applications. And Joanne, I see you have your hand up. Do you have a question?
Yeah, Teresa, I don't want to jump ahead of you, so feel free to answer this later.
Okay.
In healthcare, we've seen losses across the board from sort of the entry level all the way to sort of nursing and higher skilled jobs. And I think Workforce Competitiveness Trust Fund is great to train people at the entry level, and you're asking for people who are underemployed, and you're limiting the amount we can spend to train. A lot of healthcare organizations don't have access to the Workforce Training Fund because we don't do you see funds potentially becoming available to train to higher level roles or to train incumbent workers with all this money?
Yeah, that's a great question. I will start by saying that because so much of this 31 million that we put out the door was we put out an RFP in October, is funded through ARPA dollars, and that ARPA dollars, like the language around who's eligible is very specific. And so we're actually looking at, it's either somebody who's unemployed, which that's clear, or if you're underemployed, you're working 60%, it's 60% or less of median income. And in the RFP, there's a very specific chart. So I think that might be, it's actually generous from an underemployed worker perspective, but certainly would exclude folks who are making more than that and potentially an incumbent worker. And we definitely have talked about whether the gap that you're identifying is definitely a gap that we have identified also, and we're looking at all the available resources. And so I don't have a firm yes for you on like that there are available resources, but it's definitely very much on the top of our minds and trying to figure out how can we provide that solve, because we definitely hear that.
Thanks, Teresa, that's helpful.
And I'll just quickly add in that if it's granted, right, the EDA Good Jobs Challenge grant would be able to cover incumbent workers.
Oh, that's great.
Yeah,
that's awesome. Yeah, and that's a great way of leveraging that with these other resources. That's awesome. Also, just so you know, typically when we had a smaller pool of these resources, we were trying to give out smaller grant amounts. We have a lot more resources with 31 million. So we're giving grants of up to 500,000 for single grant providers and up to $1 million for multiple provider or multi regions and high throughput applicants. So if you have an idea, and especially in Boston, Angela, to your point around Boston just being such a bigger area, if you have an idea that is, you have multiple training providers that are all coming together on the same, curriculum and multiple employers, very possible that, you can go for a much bigger grant. And so certainly think about that as an opportunity. We're trying to, again, make it not cumbersome to continue to apply for lots of different grants. But if there's a good idea that it just is going to cost more, we actually are at the point in time where we have the resources to fund something like that. We're also, as you know, employers are really key to this partnership. So we're looking for at least 2 committed employers to be part of every partnership, as well as a training partner. There are lots of other partners that should be at the table. We are strongly recommending your Mass Higher Career Center and Workforce Board. But as you know, there's a lot of community-based organizations that also are very critical partners in the delivery of these programs. And so we encourage you to just think about like, who do you need at your partnership and what are the skill sets that you need to cover? We do require 30% of the funds be matched. This can be in kind. And if you run into a challenge with how to determine that, please reach out. We'd love to help you think through creative ways of documenting that. Again, the resources that we have available are pretty flexible. They can, we do a line item budget and can cover things from, staff costs to coordinate and provide case management, support, tuition, support services, marketing fees. So even participant stipends are available. And really the list of lead applicants is very broad. So I think there's probably very few organizations that would not be eligible to be the lead. And so I think as you're coming together as partnerships, just being mindful of like who has the capacity to be the lead and who has the capacity to partner on other areas. And so no one partner has to look the same across all of the different partnerships. I'll pause there and to see if there's any questions about this program. I should just say that it is a rolling application. So our first deadline was November 30th. We did get a good fair share of proposals, but there's plenty of resources available. And so we encourage everyone to continue to think about their proposals. And as you get applications in, we are looking to get answers back as quickly as possible. But probably will end up needing like a 4 to 6 week turnaround, but we'll do our best to continue to beat that and minimize the time. So I'll pause if there's any questions or comments.
I have a question. So for this funding, it would be specifically for sector-specific job training programs, not for like general job placement programs, correct?
Correct. Yeah. So there must be an occupational skills component of it. So there must be some training component that's focused on getting someone a very specific job at the end.
Thank you.
Thank you.
I'm not seeing anything in the chat. Feel free, folks, to use that if you have questions.
And actually, feel free. I mean, we can go to the next slide and we can get
I was
started, and then
Gonna
feel
say
free.
the same. Terrific.
So Ashley and Angela put together this great list of best practices, which I completely endorse, and I'll work through some of these, but Ashley, please feel free to jump in, especially on the timing piece. So I think we like agree, like really important to, if you're considering one of these applications, is to talk to your Mass Hire board. It's good to know who else is doing something similar, and if there's any historical context. We've been doing this work for a very long time, and sometimes that is helpful, especially if we've done, sometimes you can dust off an old program for 6 years ago, and it might have some new life to it to get you started on a new program. It's also really important on the regional piece to understand, we're all going to be stretched thin on capacity. And so where there is an opportunity to leverage what another training provider is already engaged in, or another partnership, the board as the convener would have a good sense of that and be able to point you in the right direction. As Angela said, looking at your regional blueprint, and there's other data presentations. And again, the board is a really good resource for that, to understand what is within the regional blueprint and what data you can use to kind of support your documentation of need. I fully agree. Engaging employers is really important. They're really the first, the first stop that anyone should be making, and in terms of understanding where the demand is, what the priority of demand is, and really what should the program look like, and in terms of what's the right timing of year, is there a certain point in time when folks are needed? How can you align with that? How can you align with the requirements of the job? And then also, I think especially true in healthcare is really around any obstacles around testing or clinical needs. That is, I know, very complex, and I know you have a lot of smart folks around this table who have been thinking about that for a while that can give good guidance on that. But that certainly is a reality. And as folks who are going through the program, needing to move on from the entrance in terms of the first day of training all the way through placement, we know that these are areas where folks can get hung up if they haven't done some good planning in advance, and especially talk with their training and employer partners. And then I endorse being thoughtful on timing. And Ashley, if you want to say a little bit more, because you might be the recipient of a lot of these requests, that would be helpful.
Yeah, absolutely. So the note on timing is being, and I've been a perpetrator of this myself, but being conscientious of the turnaround time that it might take for someone to write or edit a letter of support, or a memorandum of agreement, or a memorandum of understanding. So in conversations with the executive committee, this was something that came up, where it's like, okay, a lot of money's coming out, a lot of partnership and collaboration is a great thing, and it's an important thing in this work, but let's be courteous to each other when it comes to those requests for signatures and approval, whether that's partnership request, or I would say more simply a letter of support. And the other piece is being conscientious of that. A letter of support isn't a guarantee, right? So folks have the right to review on behalf of their organization, or with the right person, if that is a right fit. And so one thing that came up is that if you're looking to embark on a new partnership, or create and develop a new type of program for a proposal for a grant, is to expect and be prepared to have a more in-depth conversation about your plans. And so having a meeting, whether that's with your employer partner, or with your employer partner and the training provider and the board, or whomever the right stakeholders might be, but having a conversation to say, here's what we're thinking. Again, I'll go back to some of these earlier points, but has this been done before? You know, if it has, what are the potential obstacles that, you know, people faced and strategies that they used? How can we kind of improve upon that? If it's totally new, it's like getting that feedback and really soliciting that buy-in and getting folks to understand your plans. Again, that also goes back to engaging with folks with the substance that you're of the partnership. So that's really what we mean about timing and time frame. I will be sharing some template letters of support and memorandums of understanding for folks. I'll include that in the newsletter, but also just make sure it's permanently posted on the Healthcare Careers Consortium website, which will likely come out early next week. So the newsletter and the website updates. So that's really what we mean around time frame. But I do also want to welcome, we have just a minute or so to spare. I want to address, Caitlin Dwyer had a question in the chat. Teresa, can organizations submit multiple proposals for more than one program? And then I'll say one more thing about best practices after that.
Yes, they definitely can. You know, we expect, you know, I can't guarantee like how long the 31 million will be available. And again, we're still trying to infuse additional ARPA dollars, but I imagine, if I had to guess, I would say like for a good period of time, we're going to still have resources. Like it's probably anyone's guess. So I think it's a good opportunity. If you have an idea now, go for it. And if you have another idea in 6 months, and you know, we'll find ways to keep communicating the message, and there's another good idea, like we'd love for you to come back again. So definitely be thinking about how you can lead and or partner on multiple applications.
Thank you so much, Teresa. And before we transition to our next presenter, I want to welcome you all, and I'll specifically kind of highlight the executive committee. If anyone has additional best practices that they want to share, whether that's by raising your hand and sharing out loud or putting it in the chat, I will be sure to compile that information and also put that with the template letters of support and MOAs. If anyone wants to jump in, well, I'll just take another 60 seconds or so to see if we have any more to add there. Okay.
Actually, before we jump, Teresa, thank you. That was the clearest I heard it all presented. Due date, when is the next due date? So we can kind of think backwards. Anyone who's trying to say, okay, am I in? You know, what's the timetable for the next due date?
Yeah, that's a good question. And would also love some feedback. So we set at the November 30th was the first deadline. And then we really wanted to truly move to rolling applications. I don't know if anybody would prefer that we state a new deadline. Like, I don't know if that helps with management, or if keeping it completely wide open for like rolling is helpful.
Seems like rolling is where people are at.
I'll just add, you know, I think rolling is great, but a piece that will be helpful is an update on how much money has been spent and how much is still available, because that might put a fire under some people. But I love the idea of rolling.
And the later you apply is the funding you can go for kind of prorated. You know, if someone applies now and has a 3-year window, and then the next person applies in 8 months time and only has 12-month window or something, you know, does it impact how much you can apply for?
It's a good question. It shouldn't. The looming deadline is that the ARPA dollars have to be like completely spent by the end of 25, December 25. So at some point we might just get, I mean, hopefully that all the money is allocated well before that, but at some point we might get to a later crunch. But really for now, you should just be thinking of like going for the full amount. And if that at all changes, we'll let you know. But we're allowed to make 3-year grants through the Workforce Competitiveness Trust Fund. So we're allowed to do that. So you should be able to have plenty of time, to propose what you need to, and plenty of resources. Great. Well, thank you all so much for having me, and feel free. There is more information on our website, including a recorded webinar with more information about more details, the RFP, some Q&A that's already been posted, and a link to where you can ask other questions, technical questions about the RFP. But thanks so much for considering the applications, and we look forward to receiving them all and being able to work with you all on other programs. Thanks so much.
Thank you, Teresa. Really appreciate it. So at this time, I'm going to transition us to the Care for America's Aging team. So on the call, and thank you all for joining us, we have Dr. Anthony Weiner, who's the Director of Outpatient Geriatric Psychiatry at Mass General Hospital, along with his colleague on the Care for America's Aging project, Amy Robbins of Robbins Consulting. And they're joined by their partners, whom you all likely know as well, Nancy Carpenter and Allison Simmons from the Center for Community Health Education, Research, and Service, also known as CHEERS, in the CHEERS Consortium. So Amy, I have your slides prepared unless you prefer to share your screen, but I did make you a co-host if you want to do that, but you tell me, and otherwise you can take it away.
That's great, Ashley. Thank you. Yeah, if you want to go ahead and share the slides, that would be fantastic. Good morning, everybody. It's exciting for me to see so many familiar faces on here. I'm Amy Robbins. I'm project co-director for Care for America's Aging. And I'm actually going to start us by kicking it over to my colleague, Dr. Anthony Weiner.
Well, good morning, everyone, and thank you so much for welcoming us this morning to talk about Care for America's Aging. And really, we really so look forward to getting your impressions, suggestions, and ideas about how we might collaborate in the future with you about Care for America's Aging and our workforce model, which is attached to research, bridges hospital to home, provides workforce pipeline to college. We see as relieving the burden on buckling healthcare systems and hospital systems, and offer solutions to some of the most challenging behaviors, patient behaviors that home health aides face in the home care setting. And next slide. So we have been working on Care for America's Aging for approximately the last 2 years. So yes, I've been Director of Outpatient Geriatric Psychiatry at MGH for the last 10 years. And about 2 years ago, I started thinking about what care for our aging population across this country is going to look like in the decades ahead. And it's clear that it will be at home. So the question becomes, how do we make that work? Well, it's by elevating and supporting the role of our frontline professional workforce partners, home health aides. But to us, it's more than just hiring more people and raising hourly wages. To us, it is via a first of its kind research study that looks at the impact of a unique curriculum for enhanced training of home health aides, one of our own design that we've created with an extraordinary, we feel so fortunate to have such an extraordinary group of physician researchers at MGH to have designed the curriculum. And looking at the impact of that unique curriculum on the care that home health aides provide in terms of improving the quality of life of homebound older adults with cognitive impairment, because we know that these are the patients of now and the future. Improving the quality of life of those patients' familial caregivers, however family is defined, because caregiver strain is such a real experience. And by decreasing the number of major medical events that patients experience, because with that comes cost savings, money which can be reinvested into the system to make this a financially sustainable, replicable, and scalable model. Then, with a successful model, we can enter the conversation about policy and legislation. And that's how we see Care for America's Aging having a transformative impact locally, regionally, and ideally over time nationally. But also there is a branch of the Care for America's Aging vision and plan where we offer opportunities for our home health aides participating in the study for advanced training, for additional training and education by our having reciprocal referral relationships and strategic alliances with colleges, local colleges and universities, so that those home health aides who wish it can go on to additional training in nursing, social work, mental health counseling, for advancing onto those career paths. But also we really want to invest in mentorship and support for our home health aides, so we can help make this work more appealing and attract and retain members of the workforce. We can grow the workforce over time. But Care for America's Aging starts with a pilot program. Next slide. And the centerpiece of that pilot program is the clinical research study that is, in essence, the following. We have 2 comparison groups in the study, each with 30 study units, a standard care group and an enhanced care group. In the standard care group, there is, of these study units, composed of a home.
I'm not sure if Dr. Weiner froze for anyone else.
Yes.
Okay.
He is frozen. I'm going to jump in the interest of time here and hope that he can hop back on. So in our study model, we have 2 groups, as Tony was just saying. We have the standard group and an enhanced group. In both groups, the care unit is an older adult patient with cognitive impairment, a familial caregiver, however family is defined, and a home health aide. So in our study, we have home health aides who will be trained in a standard model, and we'll talk a little bit more about what that is. And then a group that will receive the enhanced training that Tony mentioned, that's being developed with the team of experts at MGB, as well as by PHI, Paraprofessional Healthcare Institute, that has been an incredible partner for us. So the target of the enhanced training is really to help the home health aides to interact effectively with the behaviors that we see emerge in these care units. So with cognitive impairment, we see behaviors such as depression, anxiety, certainly elevated caregiver stress and burden, social, physical, and emotional issues. And so our objective with the enhanced training is really to provide some additional tools in the toolkit to those aides so that they can manage themselves in relation to these behaviors, and also help to really mitigate the elevation or escalation of these behaviors in the home. So our research study is focusing on these 2 types of groups, one with the enhanced aid training and one with the standard aid training, and really trying to demonstrate impact on these, on the behaviors that are listed here. Next slide, please.
May I just ask?
Yeah, jump on in, Tony.
Okay.
You're back.
Sorry about that.
Welcome back, Tony.
Thank you, MJ. Please go ahead, Amy. That's great.
Oh, go ahead, Tony. The short term and long term. That's great.
Well, right. We're in terms of the. I hope I'm not repeating myself here, picking up where you left off. But we are looking at the impact of the training, of the enhanced care training, on these criteria, and these are linked to the study measures that previously described about improving quality of life of homebound older adults with cognitive impairment in these areas of highest impact related to mood, agitated behaviors, pain, as well as focusing on the factors contributing to caregiver strain and looking to reduce those, as well as decreasing major medical events such as falls. But along with that, obviously, understanding the home health aides experiences as care providers, interacting with patients, family members, and in the context of the work experience. Next slide. Amy, over to you.
I am actually going to kick this over to Nancy and Allison.
Okay. Good morning. I'm Nancy Carpenter, and I'm with the Center for Community Health Education Research and Service, Director of Program Planning and Development. And we've been working since 2016 on doing home health aid training as a community resource in the greater Roxbury area, focusing on long-term unemployed or underemployed people. Particularly our mission is really to work with people in low-income housing, public housing, and publicly assisted housing. But we have a broader reach than that. You know, and we work with a lot of different community-based organizations in our outreach and recruitment. And Allison Simmons will go more into that. We've trained. Just finishing up our 12th cohort. We're at about 120 now. People who we've trained. At the end of this, we should be at about 135. And it's been a really wonderful experience building this program. We're really excited about the work that we're doing with the Center for America's Aging, because it's really bringing a new spotlight onto home health aides. And it's really great to see this recognition of how important they are in the care of people that are living at home with cognitive impairment, what it means for their families, and how the aides to learn how we can enhance what the aides can contribute to the care and the outcome. So we're really thrilled to be part of this. And it also gets us opportunity to do more training for more home health aides. So we're really excited about that. But Allison Simmons, I'd like to just introduce, and she's going to talk a little bit more about the type of training, and particularly the outreach and the work that we do to find people for these important jobs. Allison?
Allison, you might still be on mute.
I am, sorry. My name is Allison Simmons, and I am the program coordinator for the home health aid programs that we do at Cheers, as well as our other workforce development programs. So our role in the Care for America's Aging is to do the standard training and to do outreach and recruitment and try to find people. I think somebody mentioned earlier, it's getting more and more difficult, but we managed to get them. We work with a large group of community-based organizations, housing organizations, shelters and stuff, to do our outreach and recruitment to try to get people who are really interested in being home health aides and get them on a path into the healthcare careers. Our training consists of about 120 hours of training. We include training with Mothers for Justice and Equality, which some of you may know about this organization. They do a trauma-informed job readiness training. So it's not just about doing cover letters and interview skills. It's really kind of helping the folks who may have been long-term unemployed or maybe are switching careers to identify what are the barriers for them to be successful in the training, as well as barriers to be successful in employment. There's a lot of reflection, there's a lot of case studies, and those case studies are developed based on experiences our home health aides have had moving into the workforce. That is interspersed in our training. We do the standard PCAST 75-hour training. Because of COVID, we had to switch part of that online, as many other people had to do as well. And so that that is delivered through Zoom, as well as we also use the Executive Office of Elder Affairs PCAST curriculum online. The home health aid hours are provided in person. They get the standard 15 hours for that. And then we also provide in our training an enhanced, we provided 2 supportive care trainings. One is the Alzheimer's and the other one is advanced mental health. So when people graduate from our program, they get 3 certificates. They get a home health aid certificate, they get an Alzheimer's certificate, and they get mental health certificate. And then they are inducted into our Heart alumni network. And that network is provided for our home health aides as an opportunity to connect with each other, because it's a very isolating work, as people know. But we also do skill building, and we also do self-care, and we also do individual career advancement for people. We're also available to refer people throughout our CBO network for issues that they may have years after they have completed their training. And that work is supported by a grant from the Brigham and Women's Health Equity Fund. One of the things I want to mention too about our training and our outreach and recruitment, and it was mentioned earlier as terms of best practices, is we do have the employers at the table at the beginning. So after we recruit people, we run them by the employer, and then the employer and myself sit in the interviews for the candidates that we have. And we find that that is really important, because they may see things that we don't see, and vice versa. So we may be advocating for people that they might not have initially, saw something in, and they also will tell us reasons that they don't think that that's a good fit. So by the time people start training, they've already been vetted through the employer. And as soon as they complete their training, they roll right into employment. So that is our training. I don't know if I forgot anything, Nancy.
No, I think you did a great job covering it all. Thanks.
Thanks, Allison and Nancy. So I think, just to reiterate, as I've been in the workforce development field for a long time, and I think this model that Cheers has developed is really innovative. Number one, because the employer does sit at the table with them right from the beginning. And number two, because of the wraparound supports that they're providing this population to really ensure that nothing comes up during the course of training that can't be dealt with, or that they can't access some support with, so that they don't get derailed as they're making this jump into training and ultimately into employment. Okay, I think we've talked about the standard and the enhanced training. Just to reiterate that the standard training is what the state is currently offering. It's about, you said 120, Allison. I thought it was about 100, but and then the enhanced training that's in the works is another 10-hour training that Tony talked about a little bit prior. Okay, so next slide. I want to make sure we wrap up so that we have some time for your questions. So as mentioned, one of our objectives is to bring the employers to the table right from the beginning. And this is an industry that has been hit by this tension of both being incredibly understaffed and needing home health aides, and also being incredibly overworked. And so when we went to the Mass Home Care, which are the Medicaid agencies, and proposed participating in this initiative with us, they just weren't able to engage with us at this point, just because of the demands on that system. And so we're hoping to bring them on board after we get our model up and running, and really a smooth approach to this. Mass General Brigham Home Care is in the the Medicare space. And we're hoping to work with them as well. But we're going to start with Ezra Home Care, which is a private pay provider, and has been at the table with us from the beginning. But ultimately, we hope to have kind of the 3 main payer groups in home care involved in this. So we'll be able to see outcomes across kind of the spectrum of long-term care. All right, next slide, please. this is just a note. A number of you are actually on this call, so that's fantastic. Just to say that we are really working to build some collaborative partnerships so that this is bigger than the research project. Tony talked about that at the beginning. We really, we are starting with this research initiative, but we really see this as having the potential to really impact the field and to impact certainly the lives of the individual home health aides that are part of the study and ultimately home health aides moving forward, but also really to impact the field. So we've been engaging with these partners from the beginning, and certainly one of them is landing us here to present to you all. So, all right, so next slide, and I'm going to hand it back to Tony.
Thank you. In presenting Care for America's Aging to a number of groups to get feedback and help guide us in our planning and pre-implementation, one of the groups is long-term, leading age, LTSS, based in Bethesda, Washington, DC area, leaders in policy and legislation work over the decades, and one of their senior leaders, Robin Stone, in response to our presenting our plans for Care for America's Aging, said, this is the plan we've been waiting for 30 years. So really great feedback from national partner like that, as well as intramural to MGB in terms of hospital at home, population health management, our leaders in equity and inclusion. And so it's really, with Care for America's Aging, what we hope for, which is it being a magnetic idea, drawing lots of interested and supportive partners. And so many thanks again to MJ for her leadership in working with us. So we're very excited to be at this point. I want to make sure we have time for questions and answers, and to say again, thank you so much for this opportunity today. We are at this point where we are funded to launch in January. We have a 4-year timeline for Care for America's Aging, and working on completing funding for that 4-year timeline, but we are launched and essentially funded currently through 2022, and poised to start this great work. And thanks to all the partners here on the call today for that. So with the time remaining, look forward to getting your impressions, suggestions, and questions.
Hey, Tony, it's MJ. Great work, as always. You know, I love this work. I'm wondering, is there an ask for the group? Are there, will you be seeking people who are developing more home health aides? Is this a growing need? Is there there may be people in the group that may work with to train home health aides in addition to chairs? Or is this like an expansion expectation?
That's a great question, MJ. We are open to any and all conversations. We really look forward to learning from you, talking with you, and identifying ways to collaborate with you and create partnerships going forward. You know, we are just starting this. You have the information today of our plans, but so look forward to creating these conversations going forward with as many of you as possible, so we can work together on these important issues and help find solutions together.
Great.
I would just add, Tony, that I think our intent with this meeting today is really to inform everyone that we're doing this, that this is happening, and kind of what it looks like, and that we would hope to be able to come back as we have data to share and information and outcomes, just to show you what we're learning and to talk about with this group, you know, where it can go from here. So this I see as just really information sharing at this point. Would love to hear from others that are working in this space so that we're making the right connections. I just heard from Karen Shack, so thanks for that, Karen. And anyone else that is you know, looking to make a connection or working in this space, we're definitely open to any conversations.
Great.
Thank you so much to the team, Dr. Weiner, Amy, Nancy, Allison. Really appreciate you presenting today. And I think I can speak on behalf of the executive committee. We'd be happy to have you back. We look forward to learning what you all learn. And to MJ's previous points in the chat, I hope and think that it will result in some great advocacy to advance the role of and respect for and the wages of home health aides. So thank you all for giving the introduction to your work thus far and where you're going. And if you need greater connections or recruitment or anything like that in terms of participants, don't hesitate to reach back out. I know we'll be in touch, and I've appreciated our connections prior to this meeting already. And I know it was already mentioned, but this whole conversation came around because our former PIC chair, Gary Gottlieb, which I might be mispronouncing their name, but he is the Partners Healthcare CEO and geriatric psychiatrist, and introduced Dr. Weiner to Neil Sullivan, who circled back to MJ and the Healthcare Careers Consortium. And here we are, 6 months or so later. So thank you. I'm not seeing any questions at this time in the chat. I know that Sal mentioned RCC is building a home health aid and CNA program, so they'll connect with you, Amy, and team, and that's why we're here. So we have 5 minutes for closing, and I don't even need that long, but a few quick things to mention. It's the end of the year. We hope and have intentionally tried to connect meeting to meeting topics, whether that was a follow-up from a previous conversation before we go into our new presentation, or I mean, the last several meetings have been connected to funding and data, just due to where we are at the state of the state, really. If you have any feedback at all, please don't hesitate to reach out to me directly. If you're looking to present at some point or share some information in the newsletter, each newsletter at the bottom does have that form that you can fill out to submit. You can also email me directly if you just want to have a conversation, but we welcome that, and you will hear from us by the end of this week or early next week again with the newsletter, where again I'll include templates for the letters of support and memorandums, which will also be posted on the website. I'll include the employer survey from this morning, which we mentioned through Natasha's work. I'll also organize and announce the dates for next year with signups for that. That is all I have. Anything last bits from the executive committee?
I just want to thank Ashley for putting together another great, really informative meeting, organizing it and slamming it down, changing it at the last minute in some cases. And I really think this is really valuable. And I want to thank all the speakers. You guys bring so much to this group. We really appreciate it. And it's been really informative. Thank you.
Thank you so much. Well, thank you all. I wish you all a happy holiday. I hope that you're able to take some well-earned time away from the computer screen and spend it with your loved ones safely. And we'll see you in the new year. Again, happy holidays, happy new year. Thank you so much for your time this morning.
Thanks, everyone. Have a great day.